back, I don't know, maybe like after 2 weeks, and that is all because I was in the middle of getting a rhinoplasty. Yeah, please, when I'm recording, start ticking there. What? He finally stopped. So, yeah, I got a rhinoplasty, and there are, please ignore the background noise. I don't have any patience to record this video later, okay? I'm back, I don't know, maybe after like 2 long weeks, and that is because I was undergoing a rhinoplasty. I had my surgery on the 28th of July, and since then I've been like healing, I've been vulnerable, my nose is swollen, even now it's swollen. It's going to take a lot of time to heal, and there are so many things that I wish I knew about a rhinoplasty. Like, I did do my research, but when I actually went through it, it was a lot more than I expected. And yeah, today I'm going to share with you guys all of the things that I went through, like the surgery, how the healing went, what did I feel right after this, what did I feel right after the surgery, how many days it took me to come back home, the laying, the shave, was it worth it, all of that. Let's get into the video. So number one is why I got rhinoplasty. And trust me, I did not get a rhinoplasty because I was insecure about my nose. Like, nobody could make me feel insecure about anything. I mean, they could, but like, I would not feel insecure. But yeah, I really like my nose. I think I had a nose like Masau's. That's what people told me, and I really like my nose. The reason why I had to get a rhinoplasty was because Humpty Dumpty had a great fall, and Humpty Dumpty broke her nose. My entire bone was deviated to the left side, and my whole nose was like this. I'm going to put pictures and all of that. And that is why when I went to the doctor, the day I fell, I knew that something was wrong with my nose. I knew that my nose was completely shifted to one side. So I went to the doctor, and the first thing he told me is, this won't be fixed like this, you need a surgery. Until then, it was only septorhinoplasty. On the day of the surgery, I came to know that I'm having a complete rhinoplasty. I was kind of happy about it because it's a plastic surgery that I did not necessarily want to do. But now that it's happening, it's anyways a glow up, like God's plan. Like, I fell, but what did I get in return? A plastic surgery, like a new nose. So that's how I took it, and that is the whole point of me getting a rhinoplasty. It is not at all because I was interested in getting a surgery. No, this was not on the cards. This was not at all on my to-do list, but eventually it happened. Okay, now the second thing was choosing a surgeon. So the first doctor I went to was a friend of the ex surgeon that I worked with, and I went to him. And after that, when I like went to him, I got everything discussed. I got the reports, and those reports cost me 8,000 rupees. Like, what do you mean I paid 8,000 for reports, like scans? And I was like, okay, this is going to go way too far and going to be way more expensive because only the reports cost me so much. So what about the surgery, right? So I was on week for like 5 weeks, and then I went back to work. And then my work doctor is like, Adrian, I know a surgeon who's my friend, go and consult him. He'll do it for less and stuff like that. So he gave me the surgeon's number, and this is the exact same surgeon. Somebody else also recommended, but by the time he recommended me this surgeon, went to that surgeon. So that's why I couldn't go to this surgeon. And then when my present workplace surgeon told me this surgeon's name, I texted my other doctor who is like a friend, and I was like, is this the surgeon you were talking about? He's like, yeah, he's the best surgeon you would ever find. And I went to him. That is how I got my surgeon, and hands down, he is actually the best surgeon I've ever found, because even the people that I don't know, like I'm not close with, but are friends with my friends who work in the hospital he is, everybody has very good things to say. And the number of people that are lined up in his clinic and in the hospital is insane. So by that, obviously I can make out if somebody is worth it or not. So that is how I chose my surgeon. The surgery date that he gave me was then 28th. 28th was a Tuesday, and 27th I had to get admitted. And before that, it was a Sunday and a Saturday. So Saturday I went home just to chill out. Monday I came back here, and as soon as I came back here, I got ready and I left to the hospital. So 27th I got admitted, and I got these injections, test dose, all of that, and everything was chill. And the doctor comes, and she's like, he has a female assistant doctor, so she comes and is like, Adrian, eat whatever you want to eat, now, because from tomorrow you won't be able to eat it. So I took it very seriously. For afternoon I had biryani, evening I had vada pav, and then in the night I had Domino's, and after 11 o'clock I was not supposed to eat. I was about to go on NPO, and then somebody or the other kept coming, and because of that stupid reason I could not eat the chocolava cake, and it had already been 11 o'clock. And cherry on top, my period started right there on the bed on 27th. And I'm like, okay, what do? I informed the anesthetist. She's like, it's fine. So from 11 o'clock I went NPO, and on 28th morning they came and they, put IV cannula, and these people, they pricked me twice on my right hand, and it was very hurtful. And when they were pricking it on this hand, they're like, what do you do? And I'm like, I'm an OT nurse. And they're like, okay, we are so sorry, we're going to put this correctly this time, and they did. So that happened, and I think I was the most chillest patient there, because I was like, this is new, every day for me. I see surgeries every day, I see surgeries every day. So this is nothing that I would be scared of. Not even the cannula was hurting, nothing. So on 28th, around 11 o'clock, I got shifted to the pre-op, and then I had my surgery. And the only thing I remember was the doctor telling me, Aaron, like we were talking, and he's like, where are you from? I said, I'm from Bangalore. He's like, Antulu Barpun. I was like, yeah, are you from Bangalore? He's like, no. And then they were talking like she's also a OT nurse and all of that. And the last thing I remember was they telling me I didn't breathe, and I breathe. And after some time, I'm awoke, and I'm out of this operation theater. I'm on a separate bed. And I asked my friends, like, how long did the surgery go? And they're like, 4 hours. So for 4 hours, I was completely knocked out. And I, like, obviously, because they gave me general anesthesia. This right here that you see, that is a stitch, and that is where they made the incision, and they pulled up my whole nose like that, and they did the surgery. So I am done, right? And I see myself in like those two plaits, because I was like, that is how patients are dressed there when they go to surgery. So I'm wearing two plaits. I have a nebulizer on my nose because I can't breathe, and I'm like searching for my phone. I get my phone, I look at my face, and this is how I looked. This is exactly how I looked, and I kind of felt funny, like, what is this? And then more than anything, my throat hurt because of the intubation that they did. It was hurting so bad. All I wanted was water, but I was not supposed to drink water till 7:30. And I was desperately waiting for 7:30 just to drink a sip of water. And once I drank water, they shifted me back to my room, and then I finally looked at myself, and I did not want to feel like a patient again. So what I did was immediately get up, do my hair like a sleek back, put on a lip oil, and I lost my lip oil also in that stupid hospital. But yeah, put on a lip oil, and this is exactly how I looked right after I came out of my surgery. Okay, because I didn't want to feel or look terrible. After that, I think I was admitted in the hospital for 2 days, and in the daytime it was fine. I was always 24/7 sleeping because of the medications and doses and stuff. But in the night, there were times where I had terrible pain, terrible pain, and the nurse had to come, and like she had to put me on injections and stuff. And once all of that was done, on the second day my nose is completely packed. And I remember before going to the surgery, they put some very big gauze pieces into my nose, and that was painful. But removing that, oh lord, my whole life was on word. Like, it was so painful. Like, it was more painful than the surgery, than the cannula, than the injections, more painful than anything. Okay, anything I've gone through. And they removed that, and they were like, you have to put these drops and you can get discharged. So then I got discharged maybe after 2 days, and I came back home, and all I had to do was eat soft food. I had to make sure I eat soft food. So I had like khichdi and all of that, things that I've never eaten in my life. Pongal, that though I was like, I'm not eating. So then I switched to soup, switched to pasta, because obviously soft food matlab, it's not like I will eat anything. I will eat what I like only. I will not eat what do you want me to eat. So then I started eating mashed potatoes and all of that, because I was not able to bite. So that is why I could only eat soft food, right? And then after a week, I had to go back to get my plaster removed, and they did not remove my plaster because it was pretty much still swollen. So they were like, you come in the next week. So that 1 week I took for myself. I went home, and this is why I say nobody can make me feel insecure, because whole Mangalore, every day, 7 days a week, I've roamed with that plaster everywhere. And people kept looking at me like, And I kept looking at them back because what? I'm patient, can't you see? And they started feeling embarrassing. But yeah, I was roaming with the plaster, and then I came back, and finally my plaster was removed, and this is what I see. Okay, I was pretty much like, what's this? My before it was nose was much better, and then the doctor told me, you know what, Arun, it's going to take 2 weeks to a month for the swelling to come. It's going to take like maybe 1.5 months for your nose to get that actual shape. So this is not the shape of my nose, okay? So don't laugh. It's not like my rhinoplasty went wrong. This is just not healed yet, okay? And even now that it's been so many days, I started going back to work last Thursday. Thursday was fine. Friday, I took leave because I thought it was started bleeding. Saturday I went back to work. I could not work. I walked 2 steps. My nose started hurting. I could not breathe because I'm wearing a mask. It was so terrible. So they gave me another week of leave, and that is why I am at home since last Saturday I've been on leave. So the thing is, when I'm talking too much, or like I'm walking, or eating a little bit of harder food, or like opening my mouth like too much, my nose, there's a lot of pressure on my nose, and because of that my head also starts aching. So now when it's most of the times when I'm like going through something, I cry. I can't even cry now because if I cry, my nose is running and then it won't stop running. No amount of tissue papers can help it stop running, okay? And then my head starts aching too because correlated. So these are the things that I'm dealing with right after my surgery, okay? And now I don't have restrictions of like not eating certain foods because obviously I've asked the doctor, he's like, you can eat normal food. So yeah, I do eat normal food, but sometimes if it's like too spicy and all, my nose starts running and it gets very difficult. I can't breathe and I can't even put it back up. So I have to remove this knot and it just won't stop, and it's really embarrassing. And like when I eat, like I was in the momo shop eating in momos, and I told an auntie बहुत सारा आप powder डाल दीजिए, ठीक है? And her बहुत सारा was too much actually, and my nose started running and it was a whole scene there. But yeah, these are the problems that I'm dealing with right now. Now all of these things that I've gone through, but these are the things that nobody tells you. First is sleeping position. I just realized I'm a person who can't sleep straight. Like I have to be on my left side to sleep. If you're making me sleep straight, there's no way I'll fall asleep. And now because of the surgery, I can't sleep on my left, I can't sleep on my right because there's a lot of pressure on my nose, right? So I had to spend money on getting this travel pillow just to sleep, and even with that I can't sleep. So now how do I sleep? I can't fall asleep straight, and because of this I am not able to sleep up until 4 a.m., 5 a.m. Like it's very difficult to fall asleep. So my swelling, as you can see, sometimes my whole face is like puffy, sometimes my nose is like too swollen, and if I cry and also it will start swelling a lot. Now don't ask me why I cry. Everybody has seasons. So if I cry, my nose starts swelling and it hurts a lot, and especially this part, and here it's very hard, so it does start paining. So that one thing is a problem. Food intake, I can't eat a lot of spicy food because if my nose starts running in case, it won't stop, like I told. And sometimes if the food is like a little hard, I can't bite. Like this is that's my mouth's capacity to open. Like more than that, if I try to open, here it starts like it just like pulls away. That one problem I have. Social reactions. When I had the what is that? When I had the plaster, though, it was very horrible, but now it's horrible because I have a stitch, and this is a vicryl, so it'll get absorbed or it'll fall off by itself. I don't have to go to remove it, but I have to apply a cream. So whenever I apply a cream, I don't really care about like covering my face. Like why do I cover my face? Like I've not done anything wrong. So people are just like, is her nose dirty, or like what is with her nose? And then obviously they won't ask me. I love people who genuinely ask me what's wrong. These fucking stupid boys. I actually love people when they generally ask me, because back in Bangalore when I had plaster, there were people who directly asked me like, what's wrong with your nose? I appreciate it. But you staring at me, I don't like. Just ask me what is on my nose. I'll tell you that it's a stitch, and you also will be clarified on your side. What does it mean that you are nobody to me and you're just standing there and staring at me, and then I make you feel uncomfortable? But I make you feel uncomfortable by staring at your back, and then you are looking that side because you are uncomfortable. But who started this? You. You just get back what you give, right? So yeah, now because of this stitch, like people like keep staring, which is not really a problem. But yeah, that happens sometimes. Stitch kind of hurt. Like sometimes I forget that I have a stitch and I just try to blow my nose and I'm like, oh, I have a stitch, and it hurts. It hurts. Like I don't know when it'll fall off, but right now though it's not even moving and it's hurting. Like I don't know, it's very difficult to do skincare, guys. That one thing, like I can wash my face only up till here. This part I can't wash, even though my doctor told me do sponge. I did not want to take the risk because I started feeling like my skin started breaking out, not breaking out, but it started losing its texture, and that's one thing I will not sacrifice on. So I did start doing my skincare, but it's a little difficult because sometimes I just like don't realize, and I'm putting the cream and I just pull this part and this whole area hurts. So that is one thing that I'm dealing with also. So many things I'm dealing with. Now the question is, was it worth it? And my answer is obviously it was worth it, because this is what was supposed to be done for my nose. Like there was no way, no other way that my nose would be fixed. And I did end up spending a lot of money on this surgery, okay? Like a lot. Yeah, a lot of money on the surgery. And of course now though I don't feel anything because my nose is not yet healed. I don't know how many more months it's going to take, so I can't really tell anything. But for now I'm able to kind of breathe a little from my nose, but only when I'm like too exhausted. I can't, I have to breathe from my mouth. And the shape is fine, like it looks way better than it looked before. So that is one thing. So I do think somewhere it was worth it. So I don't really have a problem. There are some people who do it because they want to do it voluntarily, and for me it was not the case. For me this was a medical emergency, and that is why I had to get it done. That is why for me though it was worth it, because the only way out for me was this. Like I couldn't fix my nose any other way. So if you guys are somebody who's considering a rhinoplasty or are going to go through one, I just realized a lot of my mutuals have gone under rhinoplasty, like not proper rhinoplasty, but like septorhinoplasty, and like a few forms of, like a few other variations of the nose surgery. But yeah, if you are somebody who's going through it, going to get a rhinoplasty or have gotten a rhinoplasty and are you know um, trying to heal and recover or whatever, please make sure you subscribe, because I am going to be documenting every step of my healing process, how my nose changes, how it looked, how it's looking now, how it look a month later, like everything. And yeah, just going to take you guys along, because it's not like I'm running out of topics to make videos on. I am actually, I have to also move from this house, so that's a different story. But yeah, for now I think my videos cost 20 minutes, so that's it. That is all I have to tell. People might think that she's going to make it her whole personality that she got a surgery. Yeah, because I went through it alone. I was alone. I got it done, especially in Bangalore, because I didn't want to go back to Bangalore and like stress my parents out. I had my friends here, yeah, but now I'm alone. Like I am still recovering, I'm alone. Like so I am going to make it my whole personality, if that is what it takes, because I'm proud of whatever I'm going through alone, and like whatever, however I've handled it. So yeah, bye. Enough yap session for today. Bye.